Hey, it's Dr. Lowenstein in Santa Barbara, and I'd like to talk about contour irregularities when you have liposuction. In the last 2 days, I've seen 3 patients come to me from having had liposuction, either recently, and one person was from 15 years ago, who had contour irregularities that they wanted to fix, and it's very, very difficult to fix at this point. But I want you to understand that the main way that you avoid having contour irregularities during liposuction is doing what we call a crosshatch technique. So if you can imagine the cannulas or tubes that you take the fat out with in liposuction they're exactly that, they're long tubes. So if you're trying to take fat out of an area and you use the tube from one spot, and it goes this way and this way and this way and this way, and you're fanning it out, okay, you are very likely to end up with ripples along that plane because you're only going in one direction with this tube. So the way to fix that is to have 2 entry points, and while this direction is being addressed from here, the opposite, actually the 90-degree angle direction, is being addressed from another incision site. And that's how we get a crosshatch technique, and that allows for any rippling in one direction to be resolved because you're getting the fat from at least 2 directions. So in my practice, I always do 2-direction, bidirectional crosshatch technique, and I do it in the deep layer of fat and the superficial layer of fat. And even when I'm done with liposuction, I go over things again with very small cannulas just under the skin to give multiple layers of this crosshatch technique and avoid contour irregularities, which in my practice I haven't seen from my patients, but we certainly sometimes try to fix it from other places. So anyway, hope that gives you some understanding. Best wishes.